Bethany Medical Center, the choice for generations. Spirit, dedication, and commitment shaped the early Bethany. It has now been 100 years since a group of 6 concerned citizens decided that Kansas City, Kansas needed a quality medical facility. Using private contributions, they soon built Bethany, the first Protestant hospital west of the Missouri River. Over the decades, Bethany has become one of the most respected facilities in the Midwest. For over a century, Bethany Medical Center has been making a healthy difference in the community through its commitment to quality patient care. Mrs. Reba S. Freeman, James Phillips, L.C. Faree, Nathan Saunders, Mrs. Carrie B. Hoyt, H. Gustafson, and Mrs. Sarah J. Lane, Bethany's original board of directors, worked tirelessly with Chief of Staff Dr. S.I. Harrison to establish an excellent medical and nursing staff. Through times of both prosperity and hardship, Bethany has maintained its founder's vision of quality medical care for all. Bethany opened on May 14, 1892, in a 2-story frame house at 312 Washington Avenue in Kansas City, Kansas. Bethany's community importance was demonstrated almost immediately. Scarcely a year after its dedication, Bethany Deaconess Charity Hospital outgrew its original home and relocated to a much larger 2-story brick building on Orchard Street. The nursing school was chartered in 1895, and by 1899, Bethany had nearly doubled its patient load. The Methodist Church provided major financial support to Bethany, and in 1911, the name was changed to Bethany Methodist Hospital to reflect this contribution. Soon after, the continued increase in patient load demanded another expansion. Land was purchased at 12th and Olive, and plans were developed for a $200,000 hospital. The city created Bethany Park at the site to honor the hospital's continued community dedication. Bethany expands and thrives as a quality hospital. The new Bethany opened in 1916 at 12th and Reynolds under the direction of Miss Ethel Hastings, who had recently been appointed superintendent of nursing. Miss Hastings remained a Bethany leader for more than 50 years, guiding the hospital through 2 world wars, the Depression, and major expansion. She ensured that Bethany nurses were the best nurses you can have. This tradition of excellence remains a hallmark of Bethany today. Bethany has prevailed through several major crisis situations. 1918 brought World War I and the temporary loss of many doctors and nurses to the war effort. The great influenza epidemic of the same year claimed so many victims that tents had to be constructed on the hospital's grounds to accommodate all the patients. Bethany survived these disasters in part because of the continuing strong support from Methodist churches throughout the state. Credit also goes to the active sponsorship of the Bethany Guild, established in the early 1900s, which later became the Auxiliary. The Bethany Booth Festivals became annual traditions in Kansas communities and helped supply the hospital with linens, canned goods, and donations. Keep the light burning. During the Depression years, serving the community at large became a major financial strain. Bethany's doors were always open for everyone. There were no charity wards at Bethany. All needy patients were deemed guests of the church. It was at this time that "Keep the Light Burning" became a familiar plea for support, referring to the blue Bethany Hospital light atop the building. The expression remained the focus of fundraising campaigns for the next 30 years. During World War II, the patient load increased dramatically once again, severely testing a medical and nursing staff already depleted by military service. Bethany continued to fulfill its mission despite these obstacles. And during the 50th anniversary in 1942, Frank Rushton, board president, said, "This hospital, still the beacon on the hill as many of us know it, is a source of joy to those of us who have served it. In spite of the struggle to stay abreast of the demands of the war effort, Bethany continued to introduce important new treatment programs. In 1944, Bethany launched a building fund for a 100-bed addition to meet ever-increasing community demand. The hospital received an iron lung, new X-ray and radiology equipment, and became a distribution site for the new miracle drug, penicillin. A Bethany clinical pathologist perfected a vaccine for undulant fever, which was approved for use by the AMA. Under the leadership of Mrs. Harvey DeGoler, Bethany's Guild increased its membership from 30 to 1,000 and launched a major fundraising campaign to keep the light burning and helped fund the building addition. During the 1951 flood, Bethany provided care for victims and protected the community with free typhoid shots. Innovation and national recognition come to Bethany. In 1957, the hospital completed the new West Wing. The addition relieved the severe overcrowding that had necessitated hallway beds and enabled the expansion of several services, including maternity and pediatrics. During the late 50s, the polio epidemic and resulting parental panic was calmed by a prompt response from Bethany and its staff, who provided polio inoculations and instituted a community outreach program with schools, churches, and parent groups. In the 1950s, Bethany began to expand its tradition of providing quality health education into areas other than nursing. The Clinical Pastoral Education Program began in 1955. This program has been nationally recognized. Today, the program continues to be directed by Reverend Ray Bailey, who joined Bethany in 1956. Although first started in the late 1930s, the radiology school achieved prominence during the 1950s and has an outstanding reputation today. Educational programs were also begun in medical technology and respiratory therapy, which thrives today and is one of the few fully accredited RT schools in the area. Bethany's highly regarded medical residency program began in the 1930s as a one-year rotating internship, which was phased out in the late 1960s. A surgical residency was added in the 1950s as part of the Kansas University Medical Center outreach program. Presently, under the direction of Dr. James Bergen, the program is now a full 3-year rotation in internal medicine at KUMC, composed of residents from the departments of medicine, family practice, and psychiatry. All KUMC students receive some part of their graduate training at Bethany. Bethany's School of Nursing, founded in 1895, set high educational standards and held a long record of excellence. In the late 1960s, nursing educational standards underwent changes that made college degree work essential. Bethany acknowledged the trend and discontinued the School of Nursing in 1972. The country's first intensive cardiac care unit. In 1961, Bethany's legacy of commitment to innovation in patient care was reaffirmed by another man with a dream, Dr. Hughes Day. With his desire to improve the survival rate of cardiac patients, Dr. Day catapulted Bethany into the age of technology by establishing the world's first intensive coronary care unit. He developed procedures and standards for coronary care that are still in use today. Dr. Day coined the term Code Blue, invented the crash cart, and revolutionized intensive care nursing by integrating nurses into the critical care team. Growth and progress. Bethany became a major medical center during the 1960s under the leadership of John Millard. The South Wing opened in 1968 and added 90,000 square feet and the first hospital-based rehabilitation unit in Kansas. In 1971, the Board of Trustees changed the name to Bethany Medical Center, which more clearly defined the scope and breadth of services. The early 1970s saw more growth, including a new emergency services area and new diagnostic and treatment facilities for radiology, surgery, and the laboratory. The new Brotherson building was dedicated in 1979 to honor Louis Brotherson, who had served on Bethany's Board of Trustees for 46 years. The new building provided a new enlarged lobby and entrance, a new facility for respiratory therapy, a new intensive care unit, and GI laboratory facilities. The mid to late 1970s were a period of sweeping changes in healthcare delivery and administration. First, city dwellers were moving to the suburbs in masses, and people in Kansas City, Kansas were no exception. Secondly, hospitals were being transformed by a complex set of factors, including expensive high-tech equipment, new credential standards for staff, and governmental requirements for Medicare and Medicaid reimbursement. In addition, as the 1970s drew to a close, galloping inflation outpaced hospital charges. For Bethany, this posed a dilemma. Many urban hospitals were relocating to the suburbs. However, Bethany's Board of Trustees had not forgotten its founder's mission to serve the community as a whole. They remained dedicated to their original purpose and Kansas City, Kansas location. As the 1980s began, Bethany continued to develop innovative programs to meet the changing needs of its community. A new mental health unit and skilled nursing center opened. A work-hardening program for injured employees was created, and the area's only wound care center was established. Bethany continues to serve the community through programs such as Lifeline and the Breast Screening Clinic, which are sponsored by the Foundation and the annual Spring Gala. Groups such as the Auxiliary and Commitment to Caring provide vital support to Bethany and its patients. In the summer of 1991, a Centennial Committee was established under the leadership of Jim DeGoler. Its mission was to plan and coordinate Bethany's centennial celebration. Bethany has not only been a hospital, it has also been family. The Bethany family includes graduates of the nursing school, physicians who trained here, retired administrative staff, former nursing and physician staff members, volunteers, and community members who have been treated here for generations. This spring, we brought together members of the Bethany family whose memories included many poignant stories about the hospital and the contributions of so many. This special gathering has been dubbed the Living Legends Luncheon. We would like to share with you some of their delightful recollections. A true celebration of Bethany's centennial.
My first recollection of Bethany Medical Center, it was Bethany Hospital at the time, was when my brother was born over here. And it was my mother was over here in the hospital for about 2 weeks, and a relative brought me over on the streetcar to see my baby brother. And we walked up the front steps, I'll never forget it, into the lobby. I was allowed to go upstairs to the room and see the baby, and it was quite an event for me.
The administrator of Bethany, Ethel Hastings, he was there to see her about some little thing that wasn't really connected much with the hospital, and he walked in there and Ethel was sitting at her desk crying. Ethel was an RN. I think she was trained at Bethany. She wrapped Bethany around her life. Bethany was her life. And Jimmy said, "Why are you crying?" And she handed him a bunch of bills, which amounted to about $20,000. Money that had been spent in giving intravenous's, money spent for food already eaten, and she had no idea how it was going to be paid.
I guess I started my life in Bethany, with Bethany as an Epworth Leaguer in a little Kansas town, and we did youth festivals and contributed cans of corn and peas and so forth to be brought up here to the hospital. I always wondered how they managed to feed a hospital with single, a family-sized can of peas or beans or something, but many people did that.
My early recollection of Bethany was very involved with our family and in the community. I came to work at Bethany at the age of 16 when I was in high school and worked a couple of years and then came into the School of Nursing in 1959. So I've actually been here since 1957. I look back at lots of stories. I was listening to the doctors and I can remember lots of things through the years, and it's nice to see everyone, that has come back and shared in that time. Yesterday we were going through some of the old alumni pictures and we were able to identify clear back to 1900 the pictures of people that had been involved with Bethany and all. So it's been a treat for us, and also to contact and look up some of the people that have been involved with the history of Bethany.
The dream for Bethany that began in 1892 has not faltered through 100 years of dedicated care and commitment to this community. Bethany has always been a symbol of trust, of excellence in patient care, of commitment to reduce human suffering while respecting human dignity. As a community hospital, Bethany has been committed to healthcare education, concern for employees and staff, and meeting the needs of our community. There is no doubt the light still strongly shines, illuminating the way for the future. Bethany Medical Center, the choice for generations.